For many terminally ill patients, dying isn't the hardest part. It's the suffering that comes before it. When death is certain and suffering relentless, should patients have a right to say enough? Physician-assisted suicide, or medical aid in dying, has provided a way for patients to practice autonomy, allowing them to make a powerful decision for themselves, giving them a chance to choose what the last chapter of their life looks like. Physician-assisted suicide is when a physician facilitates a patient's death by providing medical practices or information to allow a patient to make an end-of-life decision. And it has raised one of the most profound ethical debates in modern medicine. Physician-assisted suicide has a complex history that seems to fluctuate with the shifting attitudes of society and their view on autonomy, suffering, and the role of medicine in end-of-life decisions. The idea became famous in the late 20th century with the work of Dr. Jack Kevorkian, who assisted several patients in ending their lives in the 1990s. Kevorkian's actions sparked a national controversy and debate over the ethics and legality of physician-assisted suicide. He was eventually convicted of second-degree murder for his actions and highlighted the legal risks faced by medical professionals engaging in similar practices. The idea of allowing this practice has continued to change since Kevorkian's conviction, with many states having differing views on whether or not it should be legalized. In recent years, the debate of legalization has escalated immensely. In 2021, New Mexico became the latest state to legalize physician-assisted suicide when they decided to pass the Elizabeth Whitefield End-of-Life Options Act, which allows terminally ill patients with 6 months or less to live to request medication to end their lives if they meet strict medical and legal requirements. New Mexico's recent legalization impacted the legal standing of physician-assisted suicide, setting a precedent for other states, causing them to reconsider their stance, and causing physician-assisted suicide to remain deeply divisive. So why is it such a highly debated and controversial practice? The medical community is faced with balancing the principles of ethics, autonomy, beneficence, non-maleficence, and justice. Physician-assisted suicide crosses the boundaries of these ethical principles and can be seen as physician failure to meet requirements to do their job. Not only do physicians risk backlash from going against the pillars, but also the idea of essentially taking a human life doesn't sit well over many people's heads. For those reasons, there are many different views on physician-assisted suicide, most of which come from a difference in position and perspective. Multiple studies done between 2019 and 2024 has revealed that patients and physicians have differing views regarding physician-assisted suicide. If we look at both physician and patient perspectives, we can see that each party has different reasons for forming the opinions that they have. Patients generally advocate for physician-assisted suicide, bringing up the implication of autonomy, beneficence, and justice, as well as discussing preservation of quality of life. They argue that autonomy supports a patient's rights to choose their fate, while beneficence brings relief from suffering and justice can show that physician-assisted suicide should be accessible to all those who are seeking it. Their main supporting argument is that for those suffering, it is not about choosing death. It's about choosing dignity and allowing them to control their life on their own terms and avoid prolonged agony. Physicians generally have differing views, some supporting their patients' decisions, and others having specific reasons for opposition. Physicians who oppose bring up the ethical pillars of non-maleficence and justice, stating that by ending a life they are doing harm to their patient, and accessibility to this care for everyone can easily be used for the wrong reasons, turning into a slippery slope. Physicians are also concerned that patients are not properly informed about their options, and that there are other forms of care that can comfortably help them near the end of their life. Their main argument is that instead of normalizing assisted death, physicians should be focusing on improving end-of-life care by providing relief with proper pain management, emotional support, and advanced palliative care. These perspectives continue to differ still today, and as of 2025, physician-assisted suicide is legal in several U.S. states, some with specific regulations to help ensure ethical practice and patient protection. The evolution of PAS legalization reflects an ongoing debate about rights of terminally ill patients, the role of physicians, and the ethical boundaries of medical practice. As more states and nations consider PAS laws, the debate will continue. So what do you think? Is it a compassionate option for the terminally ill, or a dangerous act that threatens the quality of life?